You're listening to In Touch with Terri, brought to you by the Inbound Podcasting Network and Terri Ross Consulting, expert management consulting and sales training to help your aesthetic practice thrive.
We're actually teaching practices how to use TouchMD as a telehealth solution. And that's why we're partnering with you, Terri, because we know that you provide so much value to your members and to your tribe. And we want to offer your tribe TouchMD for free, no strings attached, no contract. Use it for 60 days so that we can get through the eye of the storm. And really, with these features, it's going to allow you to open up your virtual practice from the comfort of your home. If you're a staff member or a doctor, you can have our consult app running on your Windows device or your iPad. And then you can have your patient on the phone with you, having their patient app opened up live. And that patient's going to be able to take a HIPAA compliant selfie that sends to you in real time. And then you can actually make detailed recommendations for products and services in real time with the patient. And then the patient can see that again instantly on their phone. That's really what makes us different from any other telehealth solution, is that we provide tools to actually give an effective consult.
The voice you just heard belongs to Tyler Tetry. He is VP of Sales for TouchMD and Terri Ross's guest here on episode 11 of In Touch with Terri, a podcast that is designed for healthcare professionals looking to develop systems and processes to attract more clients, convert more patients into paying procedures, and to generate more revenue. My name's Tim Cicerelli with Inbound Digital Media and the Content Marketing Specialist for Terri Ross Consulting. At the time of the recording of this episode, medical spas and healthcare providers offering all elective procedures have been shut down due to the coronavirus crisis. It is vital that all medical spas, dermatologists, and plastic surgeons utilize this time to stay engaged with their clients. One option is to embrace telemedicine or telehealth. In this episode, Terri and Tyler discuss all of the amazing features of TouchMD and how this imaging software can be used as an effective tool to offer remote consultations during this crisis. And as we heard Tyler mention at the top of the show, Terri and Tyler have an incredible offer exclusively for Terri's tribe. So listen until the end of the episode for more details.
Okay. Hey, tribe. Welcome. It is Terri Ross again here from Terri Ross Consulting, and I am super jazzed. First, I want to thank you before we even get started, because I did a podcast the other day with Alex, the CEO of AmSpa, and your feedback and your downloads have been amazing. So I'm so excited that you guys are subscribing and listening and continue to message me and DM me for content. But I got TNT here. Tyler Tetry, the Vice President of Sales for TouchMD, and I am so excited. Welcome, Tyler. Thank you so much for being here with me. You guys are doing amazing stuff right now with what's going on. Tell us a little bit about what TouchMD is and what you guys do.
Yeah, of course. So first thing, Terri, thank you for having me on. It's a really big deal that we're partnering with you. It's something that I've been wanting for over a year. Because I truly believe that we have the perfect synergy between our platform and your expertise. And I know I've said this to you multiple times, and I genuinely believe it, but TouchMD is Nike and Terri Ross is Tiger Woods. And that's the best way to describe the synergy. We're the tool, you're the expert. You can implement what we have. We are the software that provides these value propositions, but you are Tiger Woods and we are Nike.
Oh my God, you are so sweet. Thank you. Well, you just made my day. So thank you so much. But equally, for those of you guys that know me, I don't bullshit. I don't give you false stuff. I give you real world because it's my name, it's my brand, it's my integrity, it's my life. It's what I live for, is just to make sure that you guys are all set up and successful. And this tool, for those of you who have never seen it, is pretty freaking amazing. And before we kind of elaborate a little bit more, because I want Tyler to dig a little bit deeper about what it does specifically and how it can benefit you. But ironically, I was in Miami twice. I was lecturing and I came back and I went back to give another lecture for a company. And then I went down to San Diego. And I trained a practice down there, 22 staff, very big cosmetic derm practice. And I have never really, frankly, seen it like in action with it, where people were using it. And I got to say, they had, I think, 3 patient care coordinators. The doctor, I sat in on every consult, right? Because that's what I do when I'm observing. And I was, honest to God, blown away. I mean, and I love the way you said it. The tool was amazing, but I was also in the back, like taking notes, copious notes, like don't do this and don't say that and say it this way, right? So I'm loving this partnership and this synergy between us. I mean, I am so excited. So can we talk a little bit more about exactly what it is, what it does, why it benefits patients and practices?
Yeah, of course. So really to tell you what TouchMD is, I have to tell you what we're not. We're not an EMR system. We're not a practice management system. We've really created a league of our own, a division of our own, being a robust consultation software. And when you think of a consultation software, we're trying to develop features and benefits and apps that affect this patient experience before the patient walks into the practice, when the patient's in the waiting room, when the patient's in the consult room, in the injectable room, and then when the patient goes home. And then our goal is to be a one-stop shop, a one patient app for the patient to download when they leave the practice. And this connects to everything that they need. So, patients can see their pictures from home. They can access their consents and intake forms from home. They can access their BD, Brilliant Distinctions, Aspire rewards program from home. They can sign in or sign up for patient financing, whether that's Green Sky or Care Credit or whatever the case may be, because there's a big pain point right now with practices of they have reps coming in asking the practice to have the patient download 5, 6, 7 different apps, and patients don't want to do that. So with our patient app, one app that connects to everything, and that's just the patient app. Now, to give you a visual of really painting the picture on how the software looks and feels. So just like a website, every practice needs a website, and everybody believes in that. Everybody has it. Every website is unique. Every website is different. So with our software, we believe that every practice needs TouchMD, and every TouchMD system is branded, tailored, white labeled to showcase only what they offer. So literally, their practice logo, and then branding for their products, their procedures. If they offer cool sculpting, maybe they have their own video talking about what makes them different and why they're better at cool sculpting than another practice. But literally showcasing what they offer. Now, the software runs, as you mentioned, on iPads, and it also runs on Windows devices. So essentially, you can choose either platform. And something unique, and the audience that's listening will know this, is most software companies charge you per user or per room or device. With us, unlimited licenses, unlimited users, unlimited cloud space. So we don't nickel and dime you for those things. So we want you to put your software in each of your consult rooms. And then on an iPad or on a Windows device, when the patient's waiting, I call this your captive audience. When your captive audience is waiting, and I call this the golden minutes, 5 to 15 minutes while a patient is waiting in the consult room. Most of the time, patients are on their phone, they're looking at brochures, or they're just simply just waiting. With this, we hand the patient an iPad, pull up the product, procedure, or service that the patient's here for. So if it's a facelift, if it's M-Sculpt, if it's Kybella
Boobs.
or Volbella. Oh, yeah, boobs. Literally anything that the patient's here for, we're going to pull up that service, have that patient logged in, hand that iPad to the patient, and say something like this: "Hey, Ashley, this is our new technology that we've invested in to enhance your experience today. While you're waiting, we'd like you to go ahead and watch a video about breast augmentation. Look at some before and after pictures, view testimonials, or if you have time, hit this little back button at the top left, and you can view all of the services that we offer. We'll be with you shortly." So now the patient has time to learn about a breast aug if they haven't done their homework, or maybe they're totally sold. They've been going, talking with their girlfriends, their neighbors, they're sold on the doctor. They follow them on IG, but they didn't know that they offered injectables and fillers. So what's so nice about our software is we actually track that. We track what patients are interacting with. So before the doctor or the staff member walks into the room, they know that, oh, Ashley was here for a breast aug, but she's been looking at our skincare products, or she's been looking at Obagi or Botox or whatever the case may be. And so they can actually bring that up with the patient.
So let's talk a little bit deeper before you continue, because I kind of want to recap. And obviously my jam, I come from that corporate space. right? My first job out of school was with Johnson and Johnson. So I've sold everything. I've pitched. I know the bullshit that can come with being in sales.
Totally.
Practices want to know, why should I buy this? Are my people going to use it? What's the value proposition? And everything you just said sounds fantastic, right? And now that I've got a chance to see it, but I want to point out a couple of things that I teach because we have had this conversation. So I want to get down to the nitty gritty with practices so that you really know how well it can integrate. So you guys have heard me. For those that you have heard me, I always talk about that we need the human element in the consultation, but we need to talk about a treatment plan. We can't go in there being a symptomatic approach, talking about one thing. So what I love about what you just said, Tyler, is that now we're going to get some statistics that you would never otherwise know, right? So we talk about using that cosmetic interest questionnaire so we can elicit engagement dialogue and get feedback in terms of what else they're interested in. Talk to me about the things I teach, the CIQ, the treatment plan, and how that can be incorporated into this platform of yours so that we're not having duplicate effort or pieces of paper and then your thing, and it's just one cohesive app.
Yeah, of course. So right now we're on version 5 of our software. So we come out with a new version every 2 years. We're actually in the middle of developing an advanced CIQ, cosmetic questionnaire for patients to be able to fill out. They'll be able to fill that out on the patient app, and then that will actually prep up the marketing. So we have these smart marketing tools within the platform so that it knows that if she selected X, Y, and Z, maybe she has questions about her lips, her submental fat underneath her chin, and then she's also pointing out her flanks, and she may only be there for Botox, but our app will actually market the services based on what he or she has selected with our cosmetic questionnaire. Now, to give a more in-depth approach, if you don't want patients to just browse through marketing and education while they're waiting, a new way that our practices are using our technology is they're going to use our photo app. So we have a photo app that we include with grid lines and ghosting features for consistency. So you take a picture of the patient, line up her eyes, nose, lips, body. As soon as you take the picture, it saves in real time where you get unlimited space. And then you also have a ghosting feature. So some nice tools there. But bottom line is we take the picture, we get that in front of the patient immediately. And then instead of letting patients browse through content, we put their picture in front of them. And we open up the drawing tool that's included, and we allow the patient to circle areas of concern or areas that they would like to enhance. So give that patient 5 to 15 minutes, take advantage of that captive audience time, and then allow them to, on their own photo, circle out things that they probably would have never brought those things up with you.
I love that. Okay. So one of the reasons that I wanted to have Tyler on today and why we have decided to finally kind of merge this synergistic collaboration is because of what we're dealing with right now, right? And we're hearing it every day. It's not going away. We hope to God this thing surpasses and people are just, again, remaining healthy. But I love what Tyler and TouchMD is doing for the community right now. We know medical aesthetics practices are shut down. There's no elective procedures. And I'm trying to give as many tips and tools and resources that I can for people to actually take advantage of this time while they have a captive audience, work on your business, not just in it. And so tell us about what TouchMD is doing with the tool so that practices can do these consults, and tell us about that.
Yeah, so this is almost a hidden feature within TouchMD. Most practices purchase it to increase their conversions or increase their cross-selling or be more efficient with photos. And we have over 2,000 practices, but we have always had a handful of practices that have believed in telehealth, over the last few years and that have used our software in that way. And then when this coronavirus has hit us, I'm calling it the coronavirus storm that we're in the middle of, we've pivoted. We've really focused on enhancing those features within our platform. We're actually teaching practices how to use TouchMD as a telehealth solution. And that's why we're partnering with you, Terri, because we know that you provide so much value to your members and to your tribe. And we want to offer your tribe TouchMD for free, no strings attached, no contract, use it for 60 days so that we can get through the eye of the storm. And really with these features, it's going to allow you to open up your virtual practice by using our patient app and our consult app in conjunction with each other. And what that means is from the comfort of your home, if you're a staff member or a doctor, you can have our consult app running on your Windows device or your iPad. And then you can have your patient on the phone with you, having their patient app opened up live. And that patient's going to be able to take a HIPAA compliant selfie. And that's important to remember, a HIPAA compliant selfie that sends to you in real time. And then you are going to be able to actually put those images side by side, or you could do 3 images up to get that 3/4 front, 3/4 angle. And you can draw on those photos to consult with the patient and add text and make recommendations. And what's nice is that not only can you draw on those photos in real time, but then because we offer this robust, marketing and educational platform, you can actually make detailed recommendations for products and services. Even if you have your online skincare store or that regimen that you're promoting on Instagram, you can make those recommendations in real time with the patient, and then the patient can see that again instantly on their phone. So you're able to do this telehealth, teleconsult with the patient anytime, anywhere. And not only can you do this with, showcasing the procedure or the product and educating the patient, but you also have digital intake forms, digital consents, digital pre and post instructions, which are all so vital for the patient. So that's really what makes us different from any other telehealth solution, is that we provide tools to actually give an effective consult, which is what we've always done in the office. But now you can actually do that online with the patient, with our tools, with our digital consents, with our intake forms, and then making those detailed product recommendations. And this is all for your tribe, Terri. This is all free. Literally every aspect of our software is free for 60 days for your members.
Okay, you guys, this is amazing stuff, because I know I am getting inundated with, whether people are my clients or just people in my high performance group, emailing me, messaging me about what they can do. And certainly I've given them significant resources about really understanding your data and your KPI and running your reports of 3, 6, 9, 12 months and calling your patients now proactively, because we want and need that human element, making sure that your books are going to be filled when the doors open. But what I love about this is that one, what you mentioned is that a lot of people didn't know about it, but two, that everything is built into this platform, right? That is HIPAA compliant. In terms of what you just said, right? Your pre, your post, your intake forms, the consultation tool, the writing. I mean, you guys, this is outstanding right now. And again, part of what we want to do is give back. And so stay tuned on April 15th. Tyler and myself, TouchMD, Terri Ross Consulting, we are going to be doing a complimentary webinar. We know one of the things is using this tool is amazing, but people still struggle. I'm going to say selling because we're educating, but people still really struggle with having those conversations. I just had a call today with a client. She said, Terri, I don't know what to say. I don't know what to say. And so I'm going to help you figure out what to say, so that the webinar will be called How to Convert Telehealth Consults, and do it in a way that is not cheesy. And, we're after money right now. Of course, we all, cash is king, and we want everybody to be healthy and happy, number one. But we also know that, and I keep saying it on every podcast, I mean, us as women, our hair, our nails, our wrinkles, our Botox, I mean, these practices are going to be in super high demand, and they're going to be busy. And so if TouchMD can offer this amazing solution that is so fantastic, and if I can help you figure out the words and the language and the context, right, to get these clients on board, because you want to offer something and give something so that they feel a value. That's what we want to do. That'll be, stay tuned. That'll be April 15th at 2 p.m., but we'll be pushing out a lot of messages. And I think to Tyler's point, which we were going to kind of save till the end, so we'll just kind of do a little pre-teaser. For any of my clients, Terri Ross Consulting clients, we are offering TouchMD for 60 days at no cost. So you guys can use the tool, test it, try it. And then there's going to be some amazing financing and some other promotions and things we'll offer you if you decide you want to move forward. And then for TouchMD clients, I offer my sales training 3 ways. I offered a 2-day live training. I can come to your practice, or right now, what everybody is just really excited about taking advantage of is my online training course, which you guys will be getting an amazing promo code there too. But I want to go back to something too, Tyler, because when I teach, this is so crazy, and I actually love it. So when I teach objection handling, I kind of go down the list, right? Price, budget, downtime. Oh, my husband or my spouse doesn't know. And I love it now because for offices that have TouchMD, you can't really get around that shit. And so I say, okay, what do you want your husband to know? Or does he not know you're here? Well, he does, but he's going to want to see. Well, great. So you have your TouchMD resources. And so why don't we go ahead and call your husband right now? Or when you go home, how about I call you in about 60 minutes? You can get time to go home, have you and your husband log in. Let's look at the consultation plan. And I'll call you in about an hour so we can discuss it together. They're like, shit, what am I really going to do that? And I'm like, yep, you're really going to do that. You're really going to do
Exactly.
But people are like, God, I didn't think about that. Or again, when you guys hear that, a lot of it is just a disguise. That's not really the truth. I mean, perhaps, right? But now you have this tool to be able to actually go home and have engaging conversations with family members about what that treatment plan is. So you have buy-in. So there's so many features I love. I'm very particular about my affiliate relationships. I'm very particular about what I say offer. I mean, at the end of the day, I feel it's my name and my reputation to protect. And there have been a lot of people, and so I want to maybe flush this out a little bit in terms of context. You said we are not an EMR, and we are not a software system, patient management software system. And I think people get very confused because there are some resources that you guys offer. For example, the photography. We're like, oh my God, I have this, and then I have that. What do I do? Do you want to shed any light on some of the, I guess, duplication of tools, if you will. But more importantly, I think what I want you guys to take away from what he's saying is it is a consultation tool, right? Is that fair to say?
Yes. So that is definitely fair to say. So let me break it down a little bit more. So it's always hard to describe what we are because we really do so many things. But we are not an EMR system. We are not a practice management system. But I'll tell you what we are. We are a robust photo management system. So we have a photo app with grid lines and ghosting features to take before and after pictures. You can tag photos. You can search for tags, which is great when you're doing a podium talk or when you have a patient that wants to see certain results. You can search for age 50 or age 22 to 35 Botox. And you can also, we just partnered with Canon about a year ago. So now you can use a high-end DSLR Canon camera that syncs seamlessly in real time with our photo app. We literally integrate through the SDK license in the camera. And when you take that picture on that camera, it automatically goes into their patient file in the app, which is so cool. Another thing that we offer that I haven't mentioned yet is, and this is all included, is our waiting room looping software. So in your waiting room, through a Fire Stick that plugs into your TV, that plays all of your marketing and education, video to video, video to still image to still image. You also can have a custom loop for your cool sculpting room, for your injectable room, and we can customize those based on the audience. So it's targeted marketing per room, per audience. And then there's an algorithm that keeps it shuffled and fresh throughout the day. So that content is never monotonous. It's always fresh for the patient, for the staff, and it's targeted. So you have this waiting room looping software. You have a patient app that would also go in your waiting room so the patients can engage with the videos that are playing, the marketing that's playing. They can download the patient app. We even have practices like Dr. Joel Schlesinger in Omaha, who has patient education stations in his waiting room, and patients will go up to the consult app, which is really in kiosk mode, and they can just interact with the software, browsing through it, almost like digital brochures, digital content. And then again, in each of your consult rooms, patients are interacting and engaging. You're going to really use this as a sales aid. It's your high-end presentation tool. And then at the end of the day, when patients go home, they can relive, retain everything from home. They can sign documents, they can send pictures, they can review instructions. But it truly is this consultation platform, and the consultation is that centerpiece. Yeah, we have a photo app, we have consents and intake forms. We even have digital charting, so you can actually do your charting on an iPad. But at the end of the day, it is a consultation software.
Now, does it have any integration? Thank you, Tyler. That was great clarity and great information. But part of me having this In Touch with Terri podcast is so people can be real. We can talk about real stuff, clarify things so there's no confusion. And again, people are going to skin the cat many different ways. So I love, because we had talked about it, and I have some practices using the Canon camera, and it's amazing. But, people could have other various tools for photography, right? I won't name the names. What about if clients have ever come to you, and I'm sure they have, which one do I use, Tyler? Where do I store the photos, right? Whether it's in my patient management software. So like, what do you have a recommendation so we can kind of, clarify for the tribe here? What is there one right way? What do you think your clients do now?
Now, are you saying with what's the best EMR that we integrate with?
No. Well, that's one question. What are your integrations? And then the second was in terms of the photo management perspective, right? You have a resource, but there could be others that they have as well.
Gotcha.
What do you recommend when they're like, Tyler, what do I do? And
when they want a 3D software, a 3D imaging software, we integrate with Canfield. So if you're using Vectra or you're using Mir or you're using Vizia, we integrate with those. And as soon as you save that 3D image, that saves into TouchMD. And when you take that Vizia skin analysis, that saves into TouchMD. And then we have a lot of practices that have been using Mir for a long time. And we can integrate with that so they can continue to use Mir, and then those photos instantly save into our platform. I will say this, I've had some of the most particular plastic surgeons and dermatologists that have sworn up and down by a DSLR, which we have now, but they've been very impressed with the iPad Pro 12 megapixel quality, which has honestly surprised me because I didn't know if we'd be able to really compete with the DSLR, but we do have many practices that are very satisfied with the iPad.
All right, you guys, this was an amazing interview with Tyler Tetry, with VP of Sales for TouchMD. Tyler, any last thoughts you want to leave? But, and before you answer, we'll go ahead and answer, and then I'm going to kind of recap for everybody what we talked about, what the takeaways are, and what you guys can expect from us and from them moving forward.
If you believe in the concept of TouchMD, which is that tool to help you increase conversions, that tool to help increase your cross-selling and upselling, that tool to save you time with uploading photos, and then also believing in that patient experience, I truly believe that you need to take that next level step and work with somebody like Terri, and Terri would be the person that I would refer you to all day long to really take our software to the next level. Our software can only do so much until you actually have those skills to be able to connect with the patient, ask for the business, even just creative ways that Terri mentioned in the podcast of, hey, now you have the patient app. So you're giving me this rebuttal of you don't know if you can move forward. Now you can go ahead and download the app. I'll call you in an hour, and then you can show your before and after picture or your treatment plan that I detailed out for you to your husband or to that other decision maker in your life. So right there, you came up with a creative way. I've never even thought about using TouchMD in that perspective or even explaining TouchMD in that perspective. So I learned something from you, Terri, about TouchMD.
Thank you.
But yeah, it's important to not only have the tool, but to also be invested in the expert.
It is true, you guys. Tools are amazing. I love them. But, that human element can only go so far. So I am so very humbled and excited to be partnering with them to help you guys, continue to be successful, continue to elevate your practices, and more importantly, serving the community right now in terms of these telehealth consults and what we can do. So stay tuned for our webinar on April 15th at 2:00, where we're going to be going over how to convert these telehealth consults, more importantly, giving you guys some really great offers. So thanks, T, so much. Have a great one. Talk soon.
Thanks to Tyler Tetry, TouchMD's VP of Sales, for joining us here on In Touch with Terri. Again, TouchMD provides you with all the necessary tools to take care of your patients remotely. TouchMD is a visual consultation, marketing, and imaging software utilizing touchscreen technology that enhances the patient experience with proven revenue generation. Look for links in the episode notes to sign up for Tyler and Terry's webinar on April 15th, in which they will have even more details than we provided for you here in this episode. Now, if you're listening to this podcast after April 15th, that same link will still be good to view the recording of the webinar. The episode notes are chock full of resourceful links, including one to Terry's online video course. It's titled Practice Foundational Elements, Your Roadmap to a 7-Figure Medical Practice. This video course offers 5 modules and a bunch of bonus features that will help you build a rock-solid foundation for your business. And it's full of information that is based off of Terri's 20-plus years of sales experience and, most importantly, her proven methods of scaling a Beverly Hills medical spa, yielding growth of $600,000 in just 1 year. Now, my company, Inbound Films, had the pleasure of producing all of the marketing videos for Terri's Beverly Hills Med Spa, and we would love an opportunity to help you achieve the same success Terri had with video marketing. I offer free video conferencing consultations via Zoom, and if we find out that we're a fit, we can use this downtime to begin our strategic pre-production process so that we can be ready to film as soon as it is responsible to do so. We film all over the country, and our video products are probably more affordable than you might think. So check out the many links in the episode notes to find all the ways you can contact Terri and myself. I would love an opportunity to chat with you. Finally, one last ask is for you to please subscribe to In Touch with Terri from whichever platform you're enjoying the show from so that you don't miss a single episode. For Terri Ross of Terri Ross Consulting, I'm Tim Cicerelli with Inbound Films and the Inbound Podcasting Network.